What if the system you've been trusting with your health is missing the point? Doctors are overwhelmed, patients are dismissed, medications are handed out like candy, all while root causes are being ignored. This episode is your roadmap to reclaiming your power. We are going to discover what modern medicine is getting wrong and how we can blend it into a holistic framework for lasting wellness. But I also have a secret for you. Every week, I send out a heartfelt email to my community that goes even deeper than this podcast. I share personal stories, bonus tools, extra information, and thought-provoking prompts that you won't hear anywhere else. So if you haven't joined us yet, head over to thehealthhabit.net/newsletter. Come get yourself a weekly dose of empowerment. Are you tired of feeling overwhelmed by health advice, struggling to stay consistent, and craving more ease in your diet and calm in your mind? Then you are in the right place, my friend. Welcome to the Health Habit Podcast. I'm Maria, a nature-loving herbalist, science-obsessed nutrition therapy practitioner, and your guide to holistic healing. If you're ready for simple wellness solutions, nutrition tips, and mindset shifts to help you feel energized, fulfilled, and in control of your health, then brew up some tea or crack open a kombucha, and let's get into it. Before we dive in, I want to make this very clear. I am not anti-doctor and I'm not anti-hospitals, although I will admit I'm very skeptical of pharmaceutical medications. But I truly believe that modern medicine saves lives. We do it every day. It's amazing. But if we want true healing, we have to be willing to see the system for what it is. Extremely effective for acute care, but deeply flawed when it comes to long-term wellness. So here is my list of all the things I believe the modern medical system is getting wrong. The first problem is that modern providers get little to no training on preventative care and nutrition. Most doctors receive less than 20 hours of nutritional education, if that, throughout their entire schooling. And when it comes to preventative care, it's almost non-existent. The focus is on managing disease and symptoms, but not preventing them or really optimizing health. Problem number 2 is there's a heavy focus on specialization. Modern medicine loves specialists. Cardiologists, endocrinologists, gastroenterologists. The thing is, though, the body doesn't work in isolated compartments. It functions as a deeply interconnected system. So if we don't acknowledge that, and if the specialists aren't collaborating very well, we lose the bigger picture on how one imbalance can trigger another. And this leads to problem number 3. Fragmented care with minimal communication between providers. If patients are sent to multiple specialists who rarely speak to each other, because quite frankly they often don't have the time, this disjointed model increases the risk of having conflicting treatments, misdiagnoses, and misconnections between symptoms. Problem number 4. The goal is to suppress symptoms rather than healing the root cause. So whether it's painkillers, antidepressants, antacids, there's anti-everythings. And they all suppress those signals. They dampen them. They try to remove them. But your symptoms are a language. If we don't ask ourselves what our symptoms are trying to tell us and find that root cause, we will never actually heal. And this leads to problem number 5, which is Band-Aid solutions and reverse symptomology. So rather than asking why our symptoms are happening in the first place, most medical training teaches doctors to identify symptoms and match them to a pharmaceutical drug. That's reverse symptomology. It may suppress discomfort in the short term, but it rarely addresses the deeper issues that are driving the symptoms. And this ultimately leads to dependency and minimal healing. Problem number 6, there is a tendency to jump to more invasive solutions. And honestly, this makes sense because this is where modern medicine really excels. Invasive interventions like surgeries and strong medications are often the first resort, not the last. There tends to be little patience and time for lifestyle experimentation, gentle healing protocols, and just giving the body time to respond to foundational support. Problem number 7 is there is a very mechanical view of the body. The medical model tends to treat our physiology like a machine. You fix the part that is causing issues by prescribing the pill, and then you move on. But this approach overlooks emotional health, nervous system regulation, social connection, trauma, and stress. All of these things deeply impact our physiology. Problem number 8 is high patient volume, leading to lower quality care. Doctors are pressured to see a high number of patients per day, and this leaves very little time to explain diagnoses, to offer support, to really listen, and it discourages bio-individual care, so just personalized care, and it makes patients less likely to ask questions and advocate for themselves because we know that the doctors are stressed and pressed for time. And this links directly to our next problem. Problem number 9, there's no time for coaching, for the things that foster behavior changes. Disclaimer, behavior changes are what we need. So even when a patient gets good advice, they rarely get the support and the follow through. There's no coaching, no accountability, no practical strategies for how they can actually change their lifestyle, their daily. It's like giving somebody a map and then not teaching them how to drive. Problem number 10, we prioritize pharmaceuticals over lifestyle changes because lifestyle changes take time. And as we just talked about, there's no time for coaching, for the things that actually allow for behavior change. But medications are fast and they give the provider a sense of control over the situation. And that speed is what we prioritize, even when simple habit changes could be far more effective and avoid side effects. Problem 11, we often find providers waiting for a diagnosis to take action. Most people know something's off before their labs or scans show any problems, but many doctors won't intervene until there's a diagnosable issue. And it makes sense because of how we've designed the medical system. But that delay often lets chronic conditions fester for way longer than they need to. The reality is, you don't need a diagnosis to promote healing. Problem number 12 is the way our modern medical system is, it encourages a passive, dependent mindset. The doctor is the authority, and the patient is expected to follow instructions. And this can subtly condition people to believe that healing is outside of their control. It becomes like the doctor's job is to fix you. But true wellness requires active participation and personal responsibility. That's where the magic happens, people. Problem number 13 is there tends to be one-size-fits-all guidelines. Most protocols are built for the average body, the average person, but literally none of us are average. We all have different genetics, gut microbiomes, hormone levels, stress loads, life histories. So what works for one person may not work for another. Problem number 14 is normal lab results don't mean optimal health. If your labs are within range, you might be told that everything's fine. Don't worry about it. Even if you feel exhausted, bloated all the time, super anxious. These functional imbalances often show up long before clinical ones, so we can't just exclusively rely on abnormal lab results. And by that I mean blood work. Problem number 15 is there tends to be little to no collaboration with alternative modalities. So despite growing evidence, many doctors still dismiss things like herbalism, acupuncture, functional medicine, nutrition therapy, somatic therapies. There's just so much untapped potential here because these holistic modalities fill the gaps. They cover all the problems that the modern medical system just isn't able to solve right now. So last two problems. Number 16 is profit-driven incentives. The pharmaceutical and insurance industries have a lot of influence over what care is offered and reimbursed. And this skews healthcare towards the things that are billable, brandable, and patentable, not necessarily what is best for the patient. This further worsens problem number 15, collaboration between modern or Western medicine and holistic alternative medicine. Last and final problem number 17. There is a serious gap in our understanding of women's health. Women are far more likely to be dismissed, misdiagnosed, or told that their symptoms are psychological. Many female-specific conditions like PCOS and endometriosis, they're under-researched and they're misunderstood. So, I've just provided a whopping 17 major problems with our current approach to health. That's a lot, I know. But it's important to acknowledge these things, not so we can vilify doctors or Western medicine, but so we can become empowered. Once we see the gaps, we can start filling them in. We can combine the life-saving gifts of modern medicine with the wisdom and tools of holistic healing modalities. If we could do that, it would transform the healthcare system. So what are our solutions? We are not going to end this episode just with problems. That's not what we do here. How can we use modern medicine strategically? Here's the thing. Although we have covered a lot of problems, modern medicine is not all bad. As I've mentioned, it really shines when it comes to acute care. These are your emergencies, things like heart attacks and strokes and severe infections and broken bones and serious injuries. This is where the system truly performs miracles. The ability to stabilize, diagnose, and treat life-threatening conditions quickly is something we are so lucky to have access to. The mistake that most people make is relying on Western medicine for everything. The heart of the matter is that chronic illness, fatigue, hormonal imbalance, autoimmunity, digestive issues, anxiety, all of these things require gradual, layered, root cause work. And that's simply not where modern medicine thrives. When it comes to preventative care and long-term healing, the modern Western medical system simply fails us because it's not designed to handle these kinds of problems. So if you want to optimize your health, I highly recommend thinking of modern medicine as your partner for acute needs and holistic care as your partner for everything else, especially that prevention, lifestyle support, and for chronic conditions. If you're not sure where to begin, but you're like, heck yeah, I want to find a holistic provider, definitely check out episode 3. I break down all the different types of holistic professionals and how they can support your healing so you can pick the path that is right for you. Even though a lot of modern providers are not trained in holistic methods and may even be a bit against them, you can still combine the two approaches in a way that's intelligent and aligned with your values. You are the captain of your own health. You do not have to choose sides. You really can take the best of both worlds. Take what your doctor says, take what your herbalist or holistic provider says, and then combine those two insights into a plan that makes sense for you, your body, your beliefs, and your goals. And any good holistic provider is going to be open to helping you do this. That is the beauty of truly holistic living. It does not mean rejecting modern medicine. It means using it wisely and strategically, while building a foundation of lifestyle practices that actually support your long-term wellness. And that is everything that I wanted to cover today. I know it's a bit controversial of a topic, but it's a super important one. Hello, beautiful human. Thank you so much for listening. I hope you learned something new and felt inspired or blessed. If so, please take a moment to share this with a friend who's also working to improve their health and wellness. And leave me an honest review on Apple Podcasts. It lights me up to know that this podcast is helping you. Now, go get some sunshine on your skin, and I will meet you back here on Saturday morning for another episode. Bye!